Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, this article certainly hits home. And it was an article out of, or a study out of Morbidity and Mortality Weekly Report, looking at how many people suffer from chronic pain, which is generally defined as pain that lasts for 3 months or longer. And these people are, when they asked them, the people with chronic pain generally had pain that was present every day or every couple of days. It's something that really affected their life. 20.9, almost 21% of people, 1 in 5 actually suffered from chronic pain. High impact chronic pains. This is the stuff that absolutely interferes with your ability to function. Was 6.9, almost 7%. Interestingly enough, comparing that to studies 5 years ago, the numbers were about the same. So we're not doing any better at managing chronic pain. We don't have any new medications. The stuff we have in general usually sucks. I'll comment on that in just a minute. But a couple things to look at is, first of all, there was a very high percentage of people with comorbidities. So cardiovascular disease was really high on the list. The reality is that when we have other things wrong with us, it creates more pain. When we have more pain, it creates more dysfunction. It becomes this vicious circle. And it really takes a strong mental state, I guess probably the best word to put it, fortitude to move past that. And I've always said that if you have chronic pain, there isn't one single answer. There's going to be a team of approaches, a toolbox, and the biggest player in that is the person with chronic pain. They have to be moving, they have to have a positive mindset. It can be very difficult, but that's absolutely essential. But the reality is that, why do we have so many people in chronic pain in the first place? I think the big chunk of them is, now granted, we have things like cancer pain, and we have things like severe injuries that leave people disabled. We have other types of pain, endometrial pain, whatever. It's not all musculoskeletal pain, but a huge chunk of it is. And I have said for a long time that we mismanage the acute scenario. So here are 4 tips to make sure that your acute scenario does not transition into chronic. The first one is, we use too much ice. I am not a big fan of ice. We ice for too long. Inflammation is a hill. We've got to we want that hill to be smaller, so ice can be very good at controlling that. But generally depending upon the severity of injury, first 12 to 24 hours maybe. After that, we really need to transition to moist heat. We have to get over that hill, and I feel that ice keeps us on that side of the hill without resolving it. Number 2, too little movement. A lot of time we've told for a long time that when people are injured, they need to not be moving. That is absolutely the opposite of what we should be doing, except for very few scenarios. If you have a fracture or something, we probably need to not be moving. But in general, people stop moving, and that becomes the downfall, and it helps set in that dysfunction for chronic pain. Anti-inflammatories, not a big fan of them, have not taken them myself for 30 plus years, despite multiple martial arts injuries. I firmly, strongly believe that they interfere with the healing process. And again, we want that hill to be smaller. We can do that with local ice anti-inflammatories. It's not that easy to control when we stop trying to you take anti-inflammatories. It's not like, oh, I want them to stop at 5 o'clock. You can do that with ice. And I think that they keep us on this side of the hill. They keep us from actually clearing and getting over on the other side of that inflammation. So, and pro-inflammatory health, that feeds back into what I said about the comorbidities. If we are not healthy, we are not going to heal well. So having an overall healthy lifestyle will also steer you away from having chronic problems. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.